My name is Ashley Higgins, and I will be going through with you today the role of pharmacy in long term care. Just a little bit of background information. Defining long term care encompasses a variety of services that are provided to individuals who have lost some aspect of functioning. And to determine the type of care received is based on the individual patient's needs and circumstances. And factors for determining the type of long term care received include the level of disability, the availability of informal caregivers, their personal financial circumstance, the availability of public programs, and other personal circumstances. And generally, the patients that are receiving this type of long term care include elderly, patients with chronic diseases, such as common ones being diabetes or Parkinson's, patients who need rehabilitation because maybe they had an accident, like they broke their hip, or patients who are terminally ill. And as the number of older adults continues to rise, there is an increasing demand for long term care. And a couple of fun facts that I learned. As patients age, they're more likely to develop chronic diseases. And about 80% of the elderly population, which is considered the age of 65 or older, have at least one chronic disease. And about 50% of them have two chronic diseases. And approximately 70% of older adults will require long-term care at some point during their life, and about 40% of them will spend some time in a nursing home, which leads to the type of facilities provided by long-term care. And according to the self-care continuum, it can range anywhere from home health care, where the pharmacist may come and visit the patient in their home, and then nursing facilities is probably the most popular, and ending up with hospice, where the patient will spend the rest of their life. And the pharmacist's role in this is actually quite extensive. You'd be surprised with how much they can do. And since the long-term care is expanding and evolving, the pharmacists also need to expand and evolve to meet the patient's needs. And pharmacists can provide many different services, such as dispensing medications, consulting their patients of long-term care facilities, and talking to healthcare providers, and also, which I think is the most important, is managing the patient's complex medication regimens. And training for this is generally, they can do residencies or fellowships, and there's a geriatric pharmacy certification available. And through efforts such as medication therapy management or MTM services, pharmacists have demonstrated that they're well prepared to provide long-term care services and able to address patient care needs. And my main two references were Dr. Albano's lecture from our long-term care topic and our home health delivery book from class. Thanks.